Hello, my name is Lenin Faisuri. I'm a nurse in the state of Florida, city of Orlando. The reason for this video is to educate people about COVID-19 because me and my whole family contracted COVID-19 3 weeks ago, and our cases ranged from mild to severe. So I've been getting a lot of questions and all kind of questions. So I'm gonna do the first video is gonna be before COVID, how to prepare, symptoms. The second video is gonna be during, and the third one is gonna be after. So first of all, I wanted to explain that there is currently two tests for COVID. One is the viral test and the other one is the antibody test. The viral test is done through the nose. They stick a long stick to the back of your nose. They move it around for about 15 seconds, remove it. Some places they do it on both sides. And then the other one is in the back of your throat. They'll check it, get a sample, remove it. And then the other test is the antibody test, which requires blood, and it'll only show if you have antibodies. Antibodies get in your system or form in your system between 1 and 3 weeks. So before that, it's not going to show anything. So I recommend that if you want to know if you're having symptoms in this moment, that you do the viral test instead of the antibody. The symptoms range from moderate to severe, like I said. I'm going to read some of the symptoms, and then on the second video, I'm going to go and explain some of them and tell you what I did, what worked, what didn't work, and what made me take my mom and husband to the hospital. Headache is one symptom. Headache can be very mild or severe. The severe one sometimes comes with eye movement pain. When you move your eyes to the side, you feel pain. You also get dizziness, sometimes earache, conjunctivitis, nasal congestion with or without phlegm. The sense of smell and taste goes away sometimes, sometimes both, sometimes only one. Pain when you swallow, but also pain in the outside. When you touch your lymph nodes, you feel pain. You can get one or both. You feel body ache, you feel tiredness, bone pain, fever. Fever ranges from low to very high. You feel cough, either productive or non-productive. Productive will be when you spit out phlegm. Non-productive is just a dry cough and nothing comes out. Sometimes it makes your oxygen drop when you start coughing a lot. And the cough could be very sudden. You start having a lot of cough when you get agitated, or it could be just a small, something like just like that. That's what my husband and mom got, and they did have pneumonia. Also, gastrointestinal symptoms could be nausea, vomiting, diarrhea. Another less severe symptom is a dry mouth. You get very thirsty, and also your skin gets very dry. Then more severe symptoms could be shortness of breath, chest pain that doesn't go away with anything, confusion, very hard to wake them up, and then cyanosis, which is your lips starts turning blue, but that's a late symptom. You shouldn't wait until you're turning blue to go to the hospital. Now, some of the things that is good to have in the house, I did some home remedies. On the second video, I'm going to tell you what worked and what didn't work. But it's important to have salt, lemon, ginger, eucalypt oil, which is found in many places, especially in Hispanic stores. This one helped a lot for the pneumonia. Electrolyte drinks for dehydration because of the fever and the diarrhea and vomiting. It's good to have a lot of fruits, very juicy fruits, because you get very thirsty. Vegetable, chickens for your chicken soup. If you get the electrolyte drinks, Gatorade, anything that has electrolytes, a lot of fluids. Cleaning supplies, the health department says that only the brand Clorox and Lysol are the ones that are shown to be effective getting rid of the virus. Make sure you have a lot of laundry detergent because you're gonna have to do a lot of cleaning. Toothpaste, something important about toothpaste is that when you take the toothpaste, most of the time we do it and don't realize that every time, if this is the toothpaste, we get the toothbrush and go like this, and we're dropping all our germs into the toothpaste and picking up the ones that someone else left behind. So what I was doing, since I didn't have enough toothpaste for every single person in my house, I cleaned it every time and picked it up with something else and put it on my toothbrush. Also, make sure you have mouthwash to clean your mouth, to clean your toothbrush, and make sure you replace your toothbrush at the end of your sickness so you don't get it back. You don't get all those germs back. Also important to have, you all need to have a thermometer, because sometimes you don't feel that you have fever, but you do. And it's very important that either you use disposable ones, and if you don't have disposable covers for the thermometer, after you use it, make sure you clean it with soap and water, and then with alcohol. So clean the thermometer here and here as well, where you touch it. Make sure you don't get it wet so it doesn't damage. Another thing for people who has hypertension, diabetes, you need to make sure that the blood sugar is not dropping or getting too high. So make sure you have a glucometer to check the blood sugar, and a blood pressure cuff. You can get, if you know how to use a manual one, or you can get the electric one. It is not recommended to get the wrist one because it's not as accurate with the readings. And something that is very, very important, that if you're able to get it, this is an oximeter. This oximeter checks your oxygen. My husband didn't know his oxygen was dropping. Someone was able to get us one of this. This one you can put in any of your fingers, and it's gonna give you 2 readings. The first reading is gonna be the heart rate. The second reading is gonna be the oxygen. So the one that has a percentage sign on it will be the oxygen. You don't need to get an expensive one. The cheapest one will do the same work. And another very, very important thing is this. This is an incentive speedometer. This will help you prevent pneumonia. It will help you if you already have pneumonia. It will help you get rid of fluids in your lungs. And it even helps the fever go down, because some of the fever is caused by the fluid in your lungs. That's about it. Oh, and if you have a stethoscope, which not everyone knows how to use, but if you know how to use it, it's good to listen to your lungs. But I'm going to show you on the second video a few ways that you can tell if you have fluids in your lungs. And that's about it for this video. If you have any questions, please let me know, and I'll make sure I'll answer them on the second video. Thank you.